You can slip away in the stillness of night without a sign, without a sound. 7 silent bedtime habits that could cost you your life after 70. Imagine this. You tuck yourself in, like you've done 1,000 times before. The room is calm, the world fades, and you drift off, only to never open your eyes again. Frightening. It should be. Because once we reach our 70s, the body's defenses aren't what they used to be. Some nighttime routines that once seemed harmless can quietly become ticking time bombs, leading to heart attacks, strokes, or even sudden death while you sleep. What's truly alarming is how unnoticed these habits go. Many seniors, perhaps even you, follow these rituals every evening, never suspecting that they might be slowly undermining their health. Small choices, a glass of something too cold, a room just a bit too warm, can have devastating consequences. Are you unknowingly making these mistakes? You owe it to yourself to find out. In this video, we'll uncover 7 seemingly innocent nighttime behaviors that can put your life on the line. And the final one. It's the deadliest of all, yet it's something most people do automatically without giving it a second thought. Don't gamble with your life. Let's begin. First habit. The silent threat of late-night eating. That wears down your heart. Do you often find yourself reaching for a snack late at night? That gentle hunger before bedtime may seem harmless, almost comforting, but after the age of 70, this seemingly innocent habit can quietly become a dangerous gamble with your heart. As we grow older, our bodies shift in ways we don't always notice. The metabolism slows its rhythm, digestion becomes more sluggish, and the heart, once resilient, grows more vulnerable to stress. When you eat late, especially heavy or greasy meals, you're asking your body to stay awake and labor through digestion instead of resting and healing. And your heart? It bears the brunt of this midnight toil. Medical research has shown that eating too close to bedtime can cause sudden spikes in blood pressure, disturb your heart rate, and may even provoke irregular heartbeats. Worse still, meals high in fat or refined sugars, like that late-night slice of pie or a bowl of macaroni and cheese, cause blood sugar to rise and encourage fatty buildup in the arteries. This creates dangerous pressure on the cardiovascular system, raising the risk of heart attacks or silent strokes in the dead of night. It's a hidden danger that sneaks in while you sleep, unseen, unheard. Many older adults overlook the body's subtle distress signals after a late meal. They dismiss chest discomfort, acid reflux, or a burning sensation in the throat as trivial. But these symptoms often point to something far more serious. Gastroesophageal reflux, for instance, is common in those who lie down too soon after eating. When this happens, stomach acid can creep back into the esophagus, irritating its lining and, over time, leading to respiratory issues or even aspiration pneumonia, a condition that can be deadly for the elderly. What's more, nighttime reflux can also set off episodes of sleep apnea, a condition where breathing momentarily stops during sleep. You wake up gasping for air, unaware of what just happened, a patient once said. This repeated oxygen deprivation places a heavy burden on the heart, increasing the risk of life-threatening cardiac events. So, what can you do to protect your heart and reclaim peaceful sleep? The solution is often simpler than we think, and it starts with a shift in routine. Aim to finish dinner at least 3 hours before bedtime. This gives your body ample time to digest before you rest. Avoid rich, heavy foods and refined carbs in the evening. Instead of pasta, fried chicken, or pastries, go for grilled fish, steamed vegetables, or a small bowl of brown rice. If you find you need a snack before bed, keep it light and gentle on the stomach. A few almonds, a slice of apple, or a spoonful of plain yogurt can make all the difference, says Dr. Miller, a nutritionist specializing in senior wellness. Another tip? Elevate the head of your bed just slightly. This simple adjustment helps reduce acid reflux and supports better digestion through the night. By making these small, thoughtful changes, you ease the strain on your heart, sleep more soundly, and lower your chances of nighttime complications. But that's just the first fatal mistake. The next habit is even more insidious as it involves something that everyone does on a daily basis without imagining the risks. Second habit, the hidden risk of late-night hydration. Water is life. It nourishes, heals, and sustains us, especially as we grow older. But even life-giving habits, when mistimed, can quietly turn against us. One such habit is drinking too much water before bedtime. It seems harmless, even healthy. A warm herbal tea, a tall glass of water before turning off the lights, it feels like care. But behind this soothing ritual may lie a danger few talk about. What begins with good intentions can quietly unravel your night. Late-night hydration often leads to frequent trips to the bathroom, but the problem runs deeper than disrupted sleep. As we age, our kidneys still work through the night, but the bladder loses its capacity to hold as much. The result? The more you drink before bed, the more likely you'll wake up, again and again. And here's where the real trouble begins. Getting out of bed groggy and disoriented, with blood pressure dropping as you shift positions, sets the stage for dangerous falls. "I just needed to use the bathroom," many elderly patients have said from hospital beds after a midnight stumble. Falls in the dark are among the top reasons older adults end up in emergency rooms. The quiet of the night becomes a trap. Drowsy minds, dim lights, and weakened bodies combine in a moment that can change everything. The danger doesn't stop there. An overload of fluids can also place extra strain on the heart. Normally, during sleep, your heart rate slows and circulation eases into a restful rhythm, but excessive fluid intake before bed can prompt a rise in blood pressure and heart activity, something especially risky for those already living with cardiovascular conditions. There's another silent cost too: disrupted sleep. Each time your slumber is cut short, it chips away at cognitive health. Sleep is when your brain repairs itself, files memories, and clears away waste. Repeated interruptions can speed up memory loss, heighten brain inflammation, and have even been linked to higher risks of dementia and Alzheimer's disease. So what can you do to protect yourself? Thankfully, the solution is simple and effective. Hydrate generously during the day when your body is most active, but begin tapering off your fluid intake in the evening. Try to avoid drinking large amounts of anything, especially water, teas, or juices, at least 2 hours before bedtime. Be cautious with diuretic drinks like coffee, black tea, green tea, or even cranberry juice late in the day, as they can increase nighttime urination. If you feel thirsty before bed, just take a few small sips, no more than what's necessary to feel comfortable. Skip the full glasses or water bottles. And should you need to get up in the night, switch on a soft light, move slowly, and steady yourself. These small changes can make a world of difference, helping you rest easier and stay safe through the night. But beware. The next dangerous habit may be preventing your body from recovering properly during sleep. You may be making this mistake without even realizing it. Third habit: why sleeping in a hot room could be a silent threat. When winter nights roll in and the wind howls outside, it's second nature to turn up the heat, pile on thick blankets, and close every window tight in search of cozy comfort. But for those in their golden years, especially anyone over 70, this well-meaning routine could come with serious and even deadly consequences. What many older adults don't realize is that sleeping in an overheated room can quietly raise the risk of heart strain, dehydration, and, in the most tragic cases, sudden death during the night. You see, the human body relies on a slight drop in core temperature to ease into deep restorative sleep. This natural cooling helps the brain consolidate memories, aids in tissue repair, and promotes the kind of rest that heals us. But when the room is too warm, the body has to fight harder to release heat, and that internal battle puts extra pressure on the heart while disrupting rest. Most people don't feel it happening, says Dr. Wilson, a retired cardiologist from Michigan. But while they're asleep, their body is struggling to cool itself, and for someone with a weaker heart or compromised lungs, that can be dangerous. Excess heat doesn't just rob you of deep sleep, it also accelerates fluid loss through sweating, which can quietly thicken the blood overnight. For seniors, this dehydration raises the risk of blood clots, strokes, and heart attacks. What's more, even if you don't wake up fully, repeated interruptions to deep sleep stages can leave you feeling drained, unfocused, and vulnerable the next day. Sleep deprivation takes a toll beyond tired eyes. It weakens the immune system, drives up blood pressure, and dulls brain function, something especially concerning for those already managing heart or lung conditions. And if you're living with hypertension, heart failure, asthma, or COPD, a hot, stuffy bedroom only worsens the load. It forces your heart to pump harder and makes it more difficult to breathe, lowering oxygen levels and triggering arrhythmias or asthma attacks. So what can you do to protect your health without sacrificing comfort? The solution is refreshingly simple. Aim to keep your bedroom between 64 degrees Fahrenheit and 72 degrees Fahrenheit. Choose breathable cotton pajamas and ditch the heavy comforters for lightweight bedding. A fan or a small humidifier can help circulate the air and prevent heat from building up, while cracking open a window, even just a little, lets in fresh air that your body will thank you for. These small shifts can make a big difference, easing the strain on your heart, improving your breathing, and granting you deeper, safer rest. Now that you know that a hot room can be a hidden danger, get ready for the next dangerous habit. It involves something that many people do without realizing it and can significantly increase the risk of stroke. The fourth habit you might never suspect could be quietly increasing your risk of a stroke: your sleeping position. Most people stick to one sleep posture for decades, rarely questioning whether it's actually safe. But once you pass the age of 70, the way you rest your body at night could determine not only the quality of your sleep but the safety of your entire well-being. Recent research reveals that certain sleeping positions may disrupt blood flow, interfere with breathing, and heighten the chances of a stroke. If you've never given it a second thought, now is the time, before this seemingly harmless habit turns into a serious health threat. So, which position poses the greatest risk after 70? Sleeping flat on your back can be particularly hazardous for older adults, especially those dealing with high blood pressure, heart conditions, or sleep apnea. In this position, gravity causes the tongue and throat tissues to shift backward, partially blocking the airway and decreasing the amount of oxygen that reaches the brain. This restricted airflow can trigger episodes of obstructive sleep apnea, a disorder where breathing starts and stops multiple times throughout the night. Over time, this chronic lack of oxygen can lead to increased blood pressure, cognitive decline, and a significantly higher risk of both strokes and heart attacks. Moreover, lying on your back may impair circulation, a dangerous problem for seniors with existing vascular issues. When blood struggles to flow freely, clots can form more easily. These are the main culprits behind ischemic strokes. So does that mean sleeping on your side is the answer? Not quite. While it's often viewed as safer, sleeping on the right side can actually put pressure on the heart. It can compress the inferior vena cava, the major vein responsible for carrying blood back to your heart, slowing circulation, causing fluid buildup, and raising the risk of heart failure. That brings us to the best choice: sleeping on your left side. According to sleep specialists, this position supports healthy circulation, aids digestion, and helps reduce acid reflux. Most importantly, it promotes better blood flow to the brain, significantly lowering the likelihood of suffering a stroke while you sleep. But how do you train your body to shift from a lifelong habit to a healthier posture? It's not always easy, especially if you've grown comfortable sleeping on your back or right side. Fortunately, a few small changes can help. Tuck a firm pillow between your knees to keep your spine in alignment. This not only boosts comfort but prevents strain on your back. Place another pillow snugly behind your back to gently nudge your body to stay on the left side during the night. Consider using an orthopedic neck pillow. It can open up your airways and reduce neck pain as you adjust. And if you suffer from nighttime reflux, try elevating the head of your bed just a few inches. It can ease the burning sensation and help you breathe more easily. By committing to these subtle shifts, you can vastly improve your circulation, sleep more soundly, and reduce the danger of stroke. Now that you know the importance of the sleeping position, get ready to discover a habit that can cause dizziness, serious falls, and even fainting in the middle of the night. Fifth habit: one misstep that could leave you fainting or sprawled on the floor the moment you rise from bed. Ever stood up in the early hours and felt the room spin or your vision dim at the edges? That sudden dizziness, that momentary blackout, it's not something to shrug off, especially once you've reached your 70s. Shooting out of bed in the middle of the night can send your blood pressure plummeting in a heartbeat, stealing your balance and leaving you dangerously vulnerable. This condition, known as postural hypotension, is a silent culprit behind many nighttime accidents among older adults. Picture this. It's 3 a.m. and you wake up needing the bathroom. You swing your legs over the side and rise too fast. Within seconds, the world tilts. It feels as if the ground vanishes beneath your feet. Why? Because when you go from lying down to standing, your blood needs a moment to catch up, and in those precious seconds, your brain may be starved of oxygen, setting the stage for a fainting spell or a serious fall. The hidden danger of nighttime falls cannot be overstated. For older folks, a simple slip can spiral into something life-altering. Hip fractures, broken wrists, even head injuries, these are all too common outcomes. And the consequences don't stop at the physical. A fall can trigger a chain reaction, hospital stays, limited movement, and in the worst cases, the heartbreaking loss of independence. Fear begins to creep in, the fear of falling again. That fear makes people cautious, hesitant to move. But less movement leads to muscle loss, weaker balance, and the vicious cycle of risk starts all over again. Another concern? Fainting spells brought on by low blood pressure or dehydration. If your body isn't properly hydrated or your pressure dips too low, your brain might not get the oxygen it needs when you stand up, causing you to lose consciousness, even just for a moment. So how do you keep yourself safe during those sleepy, middle-of-the-night moments? Thankfully, the solutions are simple and powerful. First, don't rush. When you wake up, take a breath. Sit at the edge of the bed for a few seconds. Let your body adjust. This gentle pause helps stabilize your blood pressure. Second, keep a glass of water by your bedside. A few sips before rising can counteract dehydration and support blood flow. Third, light the way. Install soft night lights in your room or along the path to the bathroom. A well-lit path means fewer surprises for your feet. Next, always have something to hold on to. A bed rail, a sturdy nightstand, or even a strategically placed grab bar can provide just the support you need. And don't overlook the floor. Bare feet on slick hardwood or socks on a smooth tile can spell disaster. Choose non-slip slippers, the kind that grip the ground and protect every step. By weaving these small habits into your nightly routine, you're not just avoiding a fall, you're safeguarding your freedom, your peace of mind, your future. Now that you know how to get up safely, get ready to discover a dangerous habit that many people overlook, and that could be a sign that something serious is happening to your body. Sixth habit: snoring, breathlessness, insomnia. The silent threat. You can't afford to ignore. Snoring might seem like just another quirk of aging, something to laugh about or tease your partner over, but in truth, persistent snoring and sudden pauses in breathing while asleep could be red flags waving frantically in the dark. They may signal a serious medical condition known as obstructive sleep apnea, a disorder that, if left unaddressed, can drastically raise your risk of heart attacks, strokes, and even sudden death. So what's really happening inside your body when sleep apnea takes hold? While you're resting, the muscles in your throat relax. For some, this natural relaxation can turn dangerous. Your airway becomes narrowed or completely blocked, cutting off the flow of air. Each time this occurs, your body is starved of oxygen. Your brain jolts you out of deep sleep, forcing your heart to work overtime to keep things running. And this doesn't happen once or twice. It can repeat dozens, even hundreds of times each night, without you ever knowing. This repeated oxygen deprivation slowly wears down your cardiovascular system. It drives up blood pressure, strains your heart, and lays the groundwork for heart disease and stroke. And there's another cruel twist. People with apnea never truly reach deep restorative sleep. So even if you think you've slept through the night, your body hasn't rested. The result? Crippling fatigue, lapses in memory, foggy thinking, and an elevated risk of falls, dementia, and Alzheimer's. But here's the kicker. Most people living with sleep apnea have no idea. It's often the person sharing the bed or a concerned family member who first notices the signs. Loud, disruptive snoring, long pauses between breaths, or a sudden gasp for air in the middle of the night. Other symptoms might show up quietly: a parched mouth when you wake up, throbbing headaches in the morning, dragging exhaustion that coffee can't fix, or drowsiness that shadows you even after a full night in bed. If any of this sounds familiar, it's time to see your doctor and schedule a sleep study, and let's not overlook insomnia. While it's easy to chalk it up to stress or age, chronic trouble falling asleep or staying asleep could be your body's way of waving another warning flag. Insomnia, like sleep apnea, may be connected to deeper issues, cardiovascular disease, neurological imbalances, or hormonal dysfunctions. When sleep is fractured night after night, the toll can be immense. Weakened immunity, rising blood sugar, and higher stress levels that worsen everything from high blood pressure to diabetes. So, what can you do to protect your sleep and your life? Start with small but impactful changes. Try not to sleep on your back. Lying this way makes it easier for your airway to become blocked. Instead, sleep on your side to help keep your breathing passages open. Keeping a healthy weight is crucial too, since extra fat around the neck can intensify apnea symptoms. Steer clear of alcohol and sedatives before bed. These substances overly relax your throat muscles and deepen the problem. Set the stage for sleep. Make your bedroom a sanctuary, dark, quiet, and comfortably cool. And if your doctor recommends it, consider using a CPAP machine. This device helps keep your airway open all night, ensuring steady breathing and restful sleep. Taking sleep disorders seriously can add years to your life, guard your heart, and return vibrancy to your days. Now that you understand how dangerous nighttime breathing problems can be, let's turn our attention to a common mistake people make before bed, one that may be slowly poisoning your body. 7th habit. The medication you take before bed could be quietly harming you. For many Americans over 70, it's second nature to reach for a pill bottle before turning in for the night. Whether it's a sleeping aid, blood pressure pill, or a muscle relaxer, the nightly routine seems as harmless as brushing your teeth. But what if that tiny pill is quietly disrupting more than just your sleep? Most people don't realize that certain medications can interfere with your breathing, circulation, and even brain function while you sleep. The consequences? A higher risk of falls, strokes, or even respiratory arrest in the middle of the night. Sedatives and sleeping pills, especially benzodiazepines like diazepam, clonazepam, or alprazolam, are commonly prescribed for anxiety and insomnia. But while they might lull you into sleep, they also suppress your central nervous system, causing your breathing to become dangerously slow and shallow. This can be particularly dangerous for older adults, especially those dealing with heart conditions or sleep apnea. Sometimes I'd wake up feeling like I hadn't slept at all, recalls Margaret, 78, from Des Moines. Turns out the meds were doing more harm than good. These medications can also leave you groggy and mentally disoriented come morning, making trips to the bathroom or the kitchen a minefield for falls and broken bones. It's not just sleeping pills either. Some antidepressants and muscle relaxants can throw off your sleep cycle entirely, robbing you of restorative deep sleep and taking a toll on memory and cognitive sharpness. And then there's the hidden risk of taking blood pressure medication at night. While it can help manage overnight spikes, for some seniors it causes a steep drop in blood pressure, too steep. This can limit blood flow to the brain, increasing the chance of an ischemic stroke during those quiet hours before dawn. And if you've ever felt lightheaded or faint getting out of bed in the early morning, this might be why. Painkillers, too, come with their own quiet risks. It's common for older adults to take something like ibuprofen or naproxen before bed to ease aching joints. But over time, these medications can strain your liver and kidneys, making it harder for your body to flush out toxins. Some even thin your blood, increasing the risk of internal bleeding and hemorrhagic stroke. So, what can you do? First and foremost, talk to your doctor. Never stop or change a medication on your own, but ask whether safer alternatives might be available. Cut back on unnecessary sedatives. If you're having trouble sleeping, opt for gentler remedies like herbal teas, light stretching, or mindful breathing. Keep a close eye on your blood pressure if you're medicated. Invest in a home monitor and log your numbers, especially if you're dosing at night. And always be cautious of drug combinations. Some can amplify one another's effects in dangerous ways. A few simple changes in how and when you take your medications can dramatically reduce your risk and improve your quality of life. It's about sleeping safely, not just sleeping soundly. It's time to make changes and protect your life. Now that you know the 7 quiet nighttime habits that can put your life at risk, it's time to take action. Small changes to your routine can make a big difference to your health and longevity. What can you do today to improve your sleep and protect your heart, mind, and body? Maybe it's adjusting the temperature of your room, changing the position you sleep in, or avoiding that heavy snack before bedtime. Remember, every choice you make directly affects your well-being. Never underestimate the impact of healthy and safe sleep. Take care of yourself, seek medical advice whenever necessary, and adopt habits that promote a long and quality life. Your health is worth the effort.